Hi, I'm Jay from Concierge, and today we're going to talk about 3 common causes of injury in these cold winter months and how to treat them. So here in Central Mass, winter often features cold, icy weather and can lead to more risk for orthopedic injuries, traumatic accidents than any other season. So cold weather can make muscles tight, cold, stiff, increasing your risk for injury. So right now, the greatest threat in wintertime, these icy surfaces, have been snowing the past couple days. Slipping on ice is common in the elderly and in young winter sports athletes. So common injuries include wrist breaks, fractures, rotator cuff injuries, and herniated discs. So wrist breaks and fractures, when people fall, they often reach out and try to catch themselves, and this can lead to a wrist fracture. Fractures and strains, and including those with osteoporosis, are at a greater risk for an injury, not only in the wrist, but also potentially an elbow fracture as well. So this can be treated non-surgically through physical therapy. If surgery is needed for more stabilization, physical therapy can be utilized afterwards in the post-surgery phase to help regain range of motion and strength. So rotator cuff, small muscles in your shoulder. If you slip and fall on the ice and land hard on your shoulder, this can damage these small muscles at the little joint segment between your clavicle or collarbone and your scapula or shoulder blade behind where they connect. So with this fall, ligaments at this joint could also be torn or separated from your collarbone, which can also cause a strain in your rotator cuff muscles. So non-surgical treatments can be sufficient to treat these injuries. And lastly, herniated discs and low back pain. Low back pain is common anyway, but after a fall on ice, it can result in lingering low back pain. A traumatic impact can impact discs in your low back and cause a bulge. In a more serious case, can cause radiating pain down your leg. So what should you do after a fall like this? You should see a movement specialist, physical therapist. Physical therapists can do a full evaluation and treat you conservatively to get you back on your feet pain-free.